Children are hardwired to learn from challenges. We get this idea that anxiety and stress is a bad thing, and it can be very toxic, but it can also be very healthy. So a child-sized problem given in a child-sized intensity, forgetting their homework, getting in a fight with friends, not making the team at school, those are things children are naturally designed to learn from. Their brains are meant to experience hardship, persevere, problem solve, and then develop this amazing self-esteem from, I solved this problem, I can get through it. And they look to us as the adults for our reaction when we face a problem. Is this a kid-sized problem, or is this a real bad adult-sized problem? And in the pandemic, at least in my household, and from the research we know this has happened all across the world, is that children look to adults for, is this going to be okay? And the reality was none of us knew. In education, we call those adverse childhood experiences, those challenges that are way beyond age appropriate in intensity that last far too long for children to be able to navigate, and they have long-lasting consequences for children's mental health. And unfortunately, in the pandemic, children worldwide, all children experience these adverse childhood experiences on a level that we in modern history have not experienced, and our mental health system is not prepared for. So we have children, and I have a COVID kindergartner. He's now a sixth grader. I also teach sixth grade, so appreciate your prayers on that one. But he and his peers stopped a normal childhood experience in kindergarten. And things did not get back to quote unquote normal until they were in second or third grade, but I would argue they're still not normal. So we've got this group of children who are now going into their teenage years, who had these traumatic experiences that didn't get the normal social and emotional development that we would normally expect for younger children to have. And our resources are not there to really support us in that. So it did change children, and we're still, as educators and as parents, we're chasing after that and kind of failing because we're not sure what to do to reach them.